ki ngā tangata whenua Aotearoa nei, ko ka mihi o te rohi nei, ko Bruce toku ingoa. Kia ora, so my name is Bruce, so my pronouns are he, him, and I'm a public health nutritionist, so I work at the University of Auckland in teaching as a tutor and as a research assistant. So I'm just going to be presenting some of the findings from my master's thesis that I completed recently. Here we go. And this is just a little bit of an agenda for today. So Kawao, a little bit about myself. So as I said, public health nutritionist, really passionate about food and the environment, which kind of led me to this topic today, and currently living in Tamaki Makaurau. Cool, so just a little bit of background. So why we did this research in the first place. So you'll kind of see on the left there, that's just the latest data from the greenhouse gas inventory. And you can see that agriculture, or basically our food system, is nearly taking up half of our emissions at the moment. And more specifically, a lot of that is coming from the farming of ruminant animals. So that's, you can see dairy cattle, sheep, and beef there. So obviously we've got commitments under the Paris Agreement and under the Zero Carbon Act to reduce our emissions. So obviously that's a big cause for concern there. Alongside this, we've also got the present health loss as well from our food system. So you'll see there that dietary risks is the second group of risk factors that's contributing to health loss, and especially from things like cardiovascular diseases. We also know that the health impact there is inequities. So that's for tangata whenua. We know for Pacifica. Or was it a bit too low?
No, it's just the people on the thing. It's just a bit hard.
Oh, sure. Can they hear me now? Yeah, sure. So yeah, as I was just explaining, there is inequities there, and we know that those inequities are in direct violation of Te Tiriti o Waitangi, especially Article 2, which talks about Tino Rangatiratanga, and Article 3, which talks about Oretitanga, which talks about equity. So we know that that's a big cause for concern. So basically, with the health and environmental issues that we're dealing with, we wanted to build our research on existing reports. So this was the Eat Lancet planetary diet that had been developed. So this was a diet that was developed globally by the Eat Lancet Commission to kind of explain what did a diet look like that was within planetary and health boundaries. And so what we did as part of our research was to use that to see what was the cost, especially around equity, and compared that to current and healthy diets. So current diets based on national nutrition surveys and healthy based on our latest dietary guidelines. So this was a modelling study that we did. And so to do this, we used the diet cost program. So this is iterative modelling program. So what that means is that it spits out multiple different diets that then you can evaluate what the cost is among these different diets. And so you can see there, it's got the different personas. So we did it for a household. So that was for a daughter, a son, and a mother and a father. And then we had the different types of diets. And so this is what it spits out. So it tells you the food group breakdown, and then it tells you the breakdown by emissions. So incorporating the emissions part was what we did in our study. And so how we did that is that we incorporated life cycle assessment data. So this was published just recently, last year. So it basically just tracks what's the climate impact from the processing to the food being on your plate, basically. And so it's a really good indicator to kind of see where are the most emissions coming from for different foods, and where's the best point for intervention, for example. And so in terms of the results, what we found is that when you went along to from the unsustainable and unhealthy diets to the more healthy and sustainable ones, the cost increased for households. And then the inverse was true for the climate impact. So emissions decreased. And just how does this kind of look like in terms of trends? So you'll see here, each plot on this graph is a diet output. So that's from the diet cost program. And you can kind of see here is that when you go between the diets, so when you go from, say, a current one to a vegan one, it's an inverse relationship. So basically, the cost increases as emissions decrease. But when you'll see within diets, so within a group of those plots for each diet, it was a positive relationship. So it was basically increasing costs for increasing emissions. And I'll just point out as well, there's 20-year and there's 100-year, so that's global warming potential. So what that is the 20-year is just developed to account for short-lived gases. So that's things like methane. So that's why you've got bigger values for the 100-year one. So what are the big takeaways from this research? So as I was kind of pointing out, between diets, we can see that when you're transitioning from unsustainable and unhealthy diets to more sustainable and healthy diets, it's associated with an increasing cost. But within the diet, so within a current diet, for example, households are generally able to reduce their diet costs by increasing the proportion of plant-based foods. So for example, canned beans were found to be good for health and low cost and good for the environment as well when substituting for meat, for example. So overall, there's big equity concerns here, given the high cost needed for households to eat more sustainably from our research. And this is just quickly just some of the big limitations of our research. So we know that the survey data that we used to develop the current scenario is dated. So the latest one was done in 2008, 2009 for the adult nutrition survey. So we really need action there to have an updated nutrition survey. We also know that we only included one indicator of the climate impact, so that was emissions. This was due to the scope of the project being a master's project. And we also know that the diet outputs were just developed on a general population level using population data. And we didn't have, because of the scope of the project, it hasn't considered the different ethnic or socioeconomic groups, for example. So equity analysis needs to be done as well. So kind of what are the big recommendations from this research? So I kind of alluded to that around an updated national nutrition survey. So I know, for example, that the ministry's put out a request for proposal around getting the methods for a new nutrition survey. So hopefully that's a good sign that we'll get something up and running. We need more monitoring and advocacy. So there's research showing that we need to continue to advocate for this transition to more sustainable diets so that they're within the planetary and health boundaries. Also integrating sustainability into our nutrition guidelines. So this research was actually done before the latest update, which does mention nutrition more, mentions sustainability more, but we really need that to be integrated throughout dietary guidelines instead of just an add-on at the end. We need more support for growing plant-based protein sources. So we know that, for example, a lot of the plant protein sources are imported from overseas. So if we can have more support to grow those here, hopefully that can drive down cost and increase the supply of them. And then promoting sustainable, healthy and cheap foods. So this is kind of pointing back to that finding about how households can reduce their cost and reduce emissions within their diet. So that's things like doing social marketing campaigns around more, so like canned legumes and swapping beans and lentils and more sustainable plant protein sources for meat. And then developing educational tools, because we know that the research shows that public awareness around the connection between food and the environment is quite low. So we need that to be part of the puzzle, not the sole focus, but part of it. And then just quickly, future research areas that have just been highlighted. So including other indicators of climate impact into our modelling program or into future research. Modelling and analysing the impacts of health-motivated taxes on meat and processed meat. So we know that there's been previous research that's been done on this, and potentially this could help address equity concerns. And then research with human participants or household data about alignment to sustainable healthy diets. So ours was just modelling data, but it'd be great to have household data or human participants. So I know, for example, I'm working on a project which is going to link household purchases from Nielsen to greenhouse gas emissions data. So we need more of that research to help support this. And then further equity and totality assessments of sustainable healthy diets as well. Ngā mihi mahana kia koutou katoa.